Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching our earwax removal compilation video today. We've got two patients in this compilation video. The first one here is coming very thick, blocked up, sticky wax in this ear canal here, so really not hearing particularly well. Stay tuned for the second patient because that's a really interesting case. So what we've got here is this plug of wax that's surrounded by this sort of skin debris around the outside edge, which has kind of compacted the wax together and has held it in place as well. So what we're having to do first of all is use the suction tube to remove the skin debris before we can get rid of the plug that's sitting behind it. So that's what we're in the process of doing here now. The keener-eyed amongst you might have noticed that there's a little watermark now at the bottom of these videos. We're having to put these on because we're getting so many of our videos stolen and passed off as somebody else's. So a massive shout out to Connor at Durham Hearing Specialist who came up with this genius idea. So he said it was okay for me to borrow it. So if you haven't checked his channel out as well, I'll put a link into the description below. Go and check him out. It's a good channel. So what you can see here is we've got this sort of very thick plug now. We're just working on the outside edge. It's just starting to come away, but you still see this sort of drier material. There we are, from pulling to the right hand side and underneath this block. There we go. So that's that bit of skin debris that's been kind of housing and surrounding this this plug of wax here. So we're just going to draw this down. You can see it's just a bit too big to fit on the ear canal. We're just giving it a good wiggle here. There we go. We've got it through. It's on its way out. There we are. So there's that plug. You can see where the patient would have been having quite a bit of difficulty hearing on that one particular side there. When you take a look behind you, we've got a squeaky clean ear canal. It was all collected together in that skin and wax debris there. The eardrum itself looks lovely and healthy. It's shiny, it's pearlescent. It's a right side of the eardrum because the tip of the herringbone is up to the right hand side. This is the plug we removed, so half or centimetre, just under ½ an inch there. It's almost this chestnutty brown colour, which is normally an indication it's been in there a little while. Okay. This was a really interesting case. This gentleman came through. He's been having ENT issues for most of his life. Lots of issues with ear infections. He had abscesses when he was younger. So basically lots and lots of ear issues. Has his ears cleaned out quite regularly, or normally has his ear cleaned out quite regularly by the ear, nose and throat clinic here at a local hospital. But because those services are shut, this patient's gone just over about 15 months without having their ears cleaned out. So what we're going to take a look at here, we've got this very thick, darker wax material here on the outer part of the ear canal. Patient's been feeling really blocked up now for a good sort of 6-8 weeks there. So really struggling with their hearing. Hearing aids have been whistling as well as this patient wears hearing aids. So a lot going on here. You've got a good grip now on this outer section, this darker material of wax there getting pulled forward. You can see that plug coming away there. And then if we take a look behind that, you'll see a slightly lighter colour material, which is an unusual colour to see inside the ear canal. Normally that's associated with skin. So what we're doing with the suction tube here is just very gently probing around that. Okay, if we see anything a little bit more unusual in the ear canal, we do a little bit of sort of gentle probing. You can see we've got a grip on it here. It's pulling out. Now, first thought with it being this light color would be that it's some sort of cotton wool, so it's come off the end of a Q-tip, but it's just the wrong consistency. And when we take a look behind that, this looks to me like skin. Okay, so at this point we're thinking, okay, this could possibly be a false fundus. Now the patient didn't mention anything about a false fundus in their history, and they certainly wasn't aware of ever being diagnosed with one. So this looks like this may well have been a recent addition. Now a false fundus occurs when you get sort of trauma to the outer part of the ear canal or following infection. So I want you to imagine a bit like scar tissue that forms over the canal and then forms a blockage. So imagine it like a second eardrum, if you like, over the canal. And that's exactly what this is. Now you can't suck this out, okay, because a lot of the time it does have blood supply because it's the scar tissue. And it forms a perfect blockage. So you can't get this out by suction. This would have to be removed usually by surgery, and the patient would normally have to have a scan done and everything else. What I'm doing here is just tidying that skin up because there's a lot of dead skin on the surface of it. So we're just taking that away. You can see the fresher, more pink skin underneath. So this is the scar tissue that's sitting here now. It looks a little bit wet in places, so we do just gently probe it just to see if there's any other loose debris to come away. But this is actually the skin that's completely closed off the ear canal. All right, so this patient would be having a conductive hearing loss. We covered this type of hearing loss in one of our aural bite videos as well. So with this would, because there's a problem with the sound getting to the inner part, there's a blockage in the ear canal, this would be classed as a conductive hearing loss here. So patient would have reduced hearing. The reason the hearing aids were whistling is that wax is built up on the surface of it, but as the sound from the hearing aid comes out, it hits that blockage and bounces back. So it ends up escaping from the ear and feeding back into the system, which is that high-pitched shrill whistle that you hear with hearing aids. Now, this is the patient's second ear here. So I'm just clearing away this wax on the outer side. Now, false fundus are not that common, okay? You don't see them too often. I've probably only ever come across it maybe 20 times in my whole career. So to see it on one side is not common. To see it on both sides is really uncommon, okay? So this patient is, we've got this sort of outer, harder debris here, just lifting this off and trying to work this out. Now, I'm expecting this to be just a wax plug, okay? I'm not expecting to see anything behind this. But as we start to lift here, you can see that it's held really firmly in, okay? So it's almost as if it's dried onto the canal wall on one side. But as we pull down, I can see there's a little bit of flexibility to the skin just above it. And we can start to see this whole thing coming away now. But this is basically a collection of dry, dead skin and wax all matted together, if you like. So we're just going to get a good grip on this now. Lots of wiggling involved in this one, just gently pulling away from the skin behind. Now, you're always checking with your patient at this point. Are they okay? They're not in any discomfort. They're okay for you to continue. Patient was perfectly happy. You know, I'd obviously gone through suction numerous times before. You can see that plug there that came away, quite a large plug. But behind that is a false fundus on this side as well. So this patient obviously been having bilateral, so bilateral means both ears. So having problems in both sides. And what you can see is we've got that sort of dead skin debris that was wrapped in with all that wax sitting on this false fundus here as well. So we're just going to tidy this up a little bit. Patient happy for me to do this. There we go, just lifting. They can be quite sensitive sometimes, false fundus. So you always check in with your patient, as we do with every patient, but you know, you have to check in maybe a little bit more regularly with this kind of problem. So we're just taking all this away here. You can see that very, very dry material there on the outer part of the ear canal. I'm just going to use the fine end now just to tidy up around this one side. And you can see it's closed off very, very close to the entrance to the canal as well. So this ear canal will be very, very short. Don't forget, the average ear canal is about 2.5 centimeters, about an inch thereabouts. I'd be surprised if this was going in maybe more than 0.5 centimeter, 3/4 centimeter at the most. My inches are rubbish, so I'm going to say about 3/8 of an inch thereabouts. So it wasn't going in particularly deep before this canal completely closed off. So you imagine it's dampening the sound. It can't get through this, so it's going to have a really, it's going to really pull that hearing down quite a bit there, and that's happening on both sides. So we had to refer this patient back to ear, nose, and throat because they had no recollection of ever being diagnosed with a false fundus. So we've got to get them back in. You can see that scar tissue there. You can actually see it's pink, the blood vessels in there as well. So yeah, quite full up. So a really, really interesting case. This is what we removed. So we've got that's 3.5 centimeters, about just under 1.5 inches there, I would say. So yeah, quite a bit of debris came away that was sitting in front of there as well. Well, guys, I hope you enjoyed that video. If you did, then please consider liking, subscribing, following us on Instagram, doing all those things. We post new earwax removal videos every Monday, Wednesday, Friday at 9 PM UK time. So as always, guys, we'll see you next week for the next video. Take care.